How are the department's finances in your eyes first?
Not where I'd want it to be, but again, we had to actually pause we had to pause basically our cost reduction programme due to COVID.
Because this is a recurring discussion, isn't it? From well before COVID, the department has seemingly an annual trend of overspending, and that doesn't look to be stopping, really.
Well, one of the reasons, like I say, is we did have a cost improvement, cost reduction programme to be implemented in this financial year, but unfortunately due to COVID and us having to redeploy staff elsewhere, that hasn't been able to be implemented. So the first few months of the financial year, we haven't actually been able to do that, although actually if you compare the first few months with previous financial years, the department is actually lower than it has been in previous financial years.
There was some extra money from Treasury to deal with specific COVID-19 budgeting, is that right?
Yes, it's not due to COVID. I need to make that absolutely clear. There's been a special fund established with Treasury to pay for the PPE, etc., or anything that is COVID related, and which we are very, very grateful to Treasury for. But it is purely down to the fact we haven't been able yet to implement our cost reduction, cost improvement programme due to the fact that people have been redeployed elsewhere. That will now kick in from this month. But obviously we're not going to get a full year's effect because we haven't had the ability to put it in place for the full year.
At the end of May, the department was running about 2% over budget. The hospital was 9% over. This isn't a new problem, of course. It seems to be the areas of financial difficulty are in the same place each year.
They are, and that's where the cost improvement programme, which I just referred to, is actually focused on. But like I say, we haven't had a chance to implement that yet in this financial year because quite rightly all of our services have been focused on the COVID-19 issue. But now that things are returning to a semblance of normal, we can start implementing that project to actually reduce costs. But like I say, we're not going to get a full financial year's effect now because obviously we're into July, nearly August.
There's still a big reliance on locum staff. And specifically with speciality doctors, I think it's 9 out of 10 of those positions are currently vacant and therefore presumably being staffed by locum staff, which is quite an expensive way to do things, isn't it?
It's a very expensive way to do things, but the key well, obviously we're trying to recruit to the post, but it is exceptionally difficult.
Yeah.
In a lot of specialist areas, you're not just talking about competition within the UK, you're also talking wider afield. There's some areas where certain specialist positions are much sought after worldwide, so you're in a competitive marketplace across the planet, not just a competitive marketplace within the United Kingdom, and particularly Europe as well. There is shortage in specialist areas, so we're up against that. One thing we are very lucky at though is that we do have feeder links into the northwest, into hospitals over there that can assist in some areas, particularly around specialist procedures.
Given the Isle of Man's position at the minute, specifically relating to the COVID-19 pandemic, does that make it a more appealing place to come and live and work, at the risk of using the government mantra?
I would hope so. I think we've got a great island community here, and I think the island has got a lot to offer.
Is that something that's being actively marketed?
I know that the Department for Enterprise has been looking at ways of marketing the island. Obviously, that's where the responsibility rests with them.
Yeah.
And I know they are pushing forward on things like that. But we've got an absolutely beautiful island here. I think we're very lucky to live where we are, and we've got a great community. And I think it is something for us to shout about.
The report says that work's underway on a job planning system. Can you tell us a bit more about this and how that will influence costs and budgets?
So in terms of the job planning, it's around ensuring that people are on the right terms and conditions. It's around ensuring that people are at the right level. So it's amazing in some ways that the system hasn't been there before, to be quite blunt.
Does this apply to all sort of job scales, pay grades?
Yes, so it would go throughout the organisation.
Does that include consultants?
So it would include consultants as well. It is across the board to ensure that people are getting rewarded appropriately for the roles that they're doing.
Because, historically, the problem with consultants has been that effectively they're paid per unit of work. Is that right?
Yes.
Within a week. And some of these consultants have built up massive incomes basically by taking on an awful lot of work. Is that still the case, or is that too simplistic a description?
It's a bit simplistic, but I think what's more important is the fact that over the years, as I've mentioned before, inconsistencies have crept in.
Yeah.
And what's important is that we're consistent in terms of our terms and conditions and what we're offering. So there's clear line of sight. People can see what they will get rewarded for the work they're doing.
Mm-hmm.
And that's what we need to work towards. Again, it comes back to this thing we've just mentioned before of transparency in ensuring that no one's under any illusions what they're going to be paid and for what.
Patient transfers costs have been down a bit during the pandemic for probably quite obvious reasons. Lots of services have been either offline or paused at least. What does that mean in terms of kind of financial planning now that presumably lots of patient transfers are coming back online? People are going across again?
Well, we will be looking at patient transfers anyway. We were planning to anyway to see what we need to do around that, because I've had people on to me quite a bit about they fly out, they go over to see the consultant. It's a long day for them, to be perfectly frank, particularly if they're not feeling well. They go and see the consultant has a quick chat with them and they're out again.
Yeah.
They're not physically examined in any way. Those sort of appointments we will be looking to continue to do remotely where possible. People who are travelling should only be those who are actually going to receive some form of treatment or examination.
Are they still having to self-isolate upon return?
So they do have to self-isolate upon return. That is still the case with patient transfers, because the 14 days is our biggest defence at the moment against the virus based on the risk profile in the UK. Should that risk profile decrease, then obviously we may look at other options.
Is that prospect actually putting patients off going, do you feel?
I've not found that. I mean, obviously, the people we are sending at the moment are the people who really, really do need to go. There's no alternative to them going. And in some cases, it's life-saving treatment. So, people who are understanding of that, it is a frustration for them. I'm pretty certain, particularly those who have to go quite regularly. But equally, it's also a defence for them, because those are some of the people that, if they caught COVID-19, are the most vulnerable to it in the first place.